headache, personality and behavioral changes, coordination problems, nausea and vomiting. Did you know these are symptoms of brain cancer? My name is Doctor.Global. Let's discuss this disease in more detail. Primary brain tumors, gliomas and non-gliomas. A primary brain tumor is a mass of abnormal cells that starts in the brain. So it can be benign or malignant, and it is life-threatening due to the changes it causes to the vital structures of the brain. According to the National Brain Tumor Society, 1 million Americans are living with a brain tumor. Approximately 94,000 United States citizens receive a primary brain tumor diagnosis every year, and 5 7/10% of them are children, aged from birth to 19 years old. The exact causes of primary brain tumors remain unclear, but some risk factors are known. Age. Brain tumors occur more frequently in children and elderly adults. Ionizing radiation. Exposure to ionizing radiation, such as that experienced during previous cancer treatment, can increase the risk of brain tumor growth. Family history. Risk of a brain tumor increases if a close family member has had one. Genetic syndromes, such as neurofibromatosis type 1 and type 2, tuberous sclerosis complex, and others. Let's move on to the symptoms. All brain tumors grow in a closed bone chamber of a skull and can directly destroy brain cells by increasing pressure in the head. Thus, the most common clinical signs include headache, nausea and vomiting, drowsiness, seizures, loss of body functions such as movement, vision, hearing or speech, memory problems, personality and behavioral changes, pain, numbness and weakness in the lower body, along with loss of bladder or bowel control, if arises from the spinal cord, hormonal imbalance, coordination problems. When the symptoms become noticeable, the following tests are usually conducted: clinical examination of altered sensation, movement coordination tests, and cognitive status evaluation, computed tomography or magnetic resonance imaging of the brain to help locate the lesion. Positron emission tomography scan of the brain is especially effective at detecting fast-growing brain tumors. Brain biopsy involves examining tissue samples to plan the best treatment. Also, stereotactic biopsy is less invasive than surgical. A treatment approach may vary between the tumor types, since the lesions have different locations in the central nervous system. Accessibility for the surgical approach. The main treatment modalities for brain tumors are: surgical resection is the preferred initial treatment for most brain tumors. Surgery is aimed to be as complete as possible. Postoperative treatments mainly consist of radiotherapy and/or chemotherapy, radiation therapy, and radiosurgery. If the tumor is not entirely removed, radiation therapy or radiosurgery may occur after surgery. Conventional surgery may not be recommended for some patients due to the deep location of the tumor. Chemotherapy uses anti-cancer drugs to destroy tumorous cells. It is difficult to treat brain tumors because the brain is protected by the blood-brain barrier. Thus, chemotherapy with temozolomide is the preferred treatment option for patients who are not deemed eligible for surgical resection and/or radiotherapy. Concurrent chemoradiation is the use of chemotherapy and radiation therapy at the same time. Brain cancer is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, brain tumor surgery can cost twice as much in Thailand and Italy as in Colombia and Indonesia, but half as much as in South Korea and Germany. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click Your Request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Let's get back to our topic. There are about 130 different types of brain and central nervous system tumors that vary from benign to malignant and range from very rare to more common. Let's explore the most common primary brain tumors. Gliomas. Most adult brain tumors originate from glial cells, which are supportive glue-like cells that hold the brain together. These tumors are categorized by their grade and the specific type of cells from which they originate. Astrocytoma, a tumor arising from astrocytes, make up 50% of all gliomas. These tumors can vary in behavior, growing slowly as grade 2 or more aggressively as grade 3. Generally, astrocytomas have a better prognosis in children. Oligodendroglioma is a rare type developing from oligodendrocytes. It is usually low-grade. Epidemioma is a low-grade tumor that arises from ependymal cells. Glioblastoma multiforme is a fast-growing, aggressive, and most lethal brain tumor, developing from a combination of astrocytes and oligodendrocytes. Medulloblastoma is a fast-growing malignant pediatric brain tumor that develops from immature cells in their early stages of growth. 75% of medulloblastomas occur in the cerebellum, the area of the brain that regulates balance and muscle coordination. Non-glial tumors arise from areas outside the brain tissue, such as the nerves, the brain's protective covering, the meninges, or adjacent glands. Meningioma is a typically benign, slow-growing brain tumor, forming over 30% of brain tumors, originating from the meninges, protective tissues encasing the brain, and are less common in the spine. Pituitary adenoma, a benign tumor, is the most prevalent type of pituitary tumor and plays a role in hormone production in the central nervous system. Occurring at any age, they represent about 10% of primary brain tumors and are rarely cancerous, with less than 0.2% being malignant. 50% of pituitary adenomas are endocrine active, producing excessive amounts of hormones, leading to hormonal imbalances that impact various bodily functions. Craniopharyngioma, a benign brain tumor arising from small nests of cells near the pituitary stalk, represents between 2 and 5% of all primary brain tumors and between 5 and 10% of childhood brain tumors. Vestibular schwannoma, also known as acoustic neuroma, is a slow-growing benign tumor on the nerve connecting the ear to the brain. It usually causes one-sided hearing loss, tinnitus, and dizziness. When it affects the trigeminal nerve, it becomes a trigeminal schwannoma, potentially causing facial pain. Prognosis. For adult patients with malignant brain tumors, the 5-year survival rate is 35 and 0.7%, whereas for pediatric patients, it is nearly 76%. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.